Have you ever done everything right in the bedroom, yet still felt a quiet worry lingering in the back of your mind? Maybe you've asked yourself, is it actually safe to swallow vaginal fluids during oral intimacy? You want to be respectful. You want to be healthy. You want closeness, not concern. You've tried to be careful, to be clean, to be considerate, yet the question keeps coming back. If that sounds like you, you're not alone. Many men, especially after 60, carry this question silently, even when they're doing their best. You've likely taken care of your health. You've stayed active. You try to eat well. You're cautious. You believe you're being safe. And still, this one topic feels cloudy. That's not your fault. Most of us were never taught the simple, plain language science behind it. Today, I want to clear it up in a way that's calm, practical, and kind. There's a hidden factor that almost no one talks about. It isn't dramatic, it isn't embarrassing, but it changes everything about safety and comfort. I'll reveal it, and you might be surprised. In fact, I'll count down the exact steps that help most after 60. We'll walk through what to avoid, what to do instead, and the one change that many men miss, the silent error that can raise risk without you even realizing. Stay with me for the #1 shift that protects health, builds trust, and makes intimacy easier to enjoy at any age. Now, let's set the stage. The worry you feel can grow silently, gradually, without even realizing it. A little hesitation here. A small "I'm not sure" there. Over time, that quiet concern can start to chip away at connection. It can make you pull back. It can turn a joyful moment into a cautious one. And after 60, we guard our independence fiercely. We don't want anything to threaten our health, our energy, or our freedom. We want to stay strong on our feet, avoid preventable illness, and keep the life we enjoy: walking, golfing, traveling, playing with grandkids, living on our own terms. So yes, this question matters. Not because intimacy is trivial, but because intimacy is part of health: physical, emotional, relational. It keeps us connected. It keeps us human. Let's talk about the hidden enemy. It isn't vaginal fluid itself. For most healthy, infection-free couples, vaginal lubrication is a protective, natural fluid. It exists to reduce friction, keep delicate tissues comfortable, and support a healthy environment. The surprise? The real trouble, especially for older adults, often starts in the mouth: tiny cuts in the gums, microabrasions on the tongue, small sores in the throat, dry mouth that cracks tissue, recent flossing that leaves the gums a little tender. These are the silent errors. They make it easier, again, not guaranteed, but easier, for germs to find a pathway into the body. Many men think the fluid is the problem. In reality, the more overlooked risk is the condition of your mouth when you engage in oral intimacy. That's the twist most people don't realize, and it becomes more important after 60, when healing can be a bit slower and dry mouth can be more common due to medications. Here's the bridge to authority in plain English. We know from years of clinical experience and public health guidance that oral sex can transmit certain infections. Not always. Not usually in long-term, mutually monogamous, infection-free couples. But the risk is not zero. Germs like herpes simplex, gonorrhea, chlamydia, syphilis, and, far less commonly but still possible, HIV can be passed through contact with infected fluids or sores. Cuts in the mouth can be a gateway. So can active cold sores. So can oral inflammation. None of this means you should fear intimacy or avoid it forever. It means small, smart choices, especially about your mouth and timing, make a real difference. That's the paradigm shift. What most people don't realize is that protecting oral tissues is as important as anything else you do. Let's make this practical with a simple, senior-friendly countdown. I'll give you 8 ranked items. We'll start with warnings, what to avoid, then shift to solutions and alternatives. For each one, you'll get the problem, the plain language science, the personal impact after 60, and an easy action you can take today. Between items 7 and 4, I'll highlight what's worse moments so you can see why each step matters. And I'll keep teasing the #1 change that surprises most seniors because it's so often missed. Ready? Problem first: active sores, sickness, or irritation. Problem after 60. Mouth sores, cold sores, sore throats, or oral thrush can happen more often, and healing can be slower. If you have a cold sore, fever blister, or your partner has genital sores, oral intimacy can spread infection more easily. Science, plain. Germs love broken skin. A sore is like an open door. If a virus or bacteria is present, a sore increases the chance it can enter. Personal impact. A small sore can become a big setback. An avoidable infection can sap energy, disturb sleep, and lead to doctor visits you don't need. This can ripple into balance, mobility, and confidence. Simple action. If you have a cold sore, sore throat, mouth ulcer, or recent oral irritation, skip oral intimacy until it's fully healed. If your partner has genital sores or unusual irritation, wait until they've been checked and cleared. This isn't rejection, it's respect and protection for both of you. Fresh dental work or just brushed, flossed. Press pause. Problem. After 60. Right after flossing or brushing, especially if you brushed hard, tiny gum cuts can occur without you noticing. Dental cleanings can also create microabrasions. Science. Plain. Those tiny cuts are the silent error. They're invisible to you, but they can act like small doorways. Personal impact. After 60, gum tissue may be more delicate. Many medications cause dry mouth. Dry tissue cracks easier. We want to protect that. Simple action. Avoid oral intimacy for at least several hours after brushing or flossing. Even better, make oral intimacy happen before you brush at night, not after. If you had dental work or a cleaning, give it at least 24 hours or follow your dentist's advice. Rinse gently with water, not harsh mouthwash if you want to freshen up. What's worse is when we do everything clean and think that means safer, but the scrubbing itself creates microcuts. Clean is good. Timing is better. Here's the twist. The safest mouth is a calm mouth, not a freshly scrubbed one with tiny abrasions you can't see. Unknown status or untreated infections. Problem. After 60. New relationships are joyful, but health histories are sometimes a mystery. Assuming safety without talking can be a silent error. Science. Plain. Some infections have no symptoms for long periods. You can't tell by taste, smell, or look. Personal impact. One unexpected infection can lead to antibiotics, office visits, and stress that steals energy. It can strain trust. Simple action. Make testing a normal part of connection when relationships are new or open. A simple agreed schedule, such as before becoming intimate with a new partner, and then periodically, based on your situation, may help. If it feels awkward, say, "Our health matters to me. Can we check together so we can relax and enjoy?" That one line often turns anxiety into teamwork. What's worse is waiting until worry builds. Anxiety creeps into sleep. Your blood pressure nudges up. Your appetite drops. Your energy dips. All because a small talk was skipped. The conversation is the low-stress path. Harsh soaps, perfumes, and douching. Problem after 60. The vaginal environment changes with age and hormones. Harsh soaps and perfumed products can irritate delicate tissue and upset the natural balance. Science plain. Healthy vaginal flora often includes friendly lactobacillus. It helps keep the pH slightly acidic, which supports comfort and defense. Harsh products can disrupt that balance, leading to dryness or irritation. Personal impact. If your partner is uncomfortable, intimacy becomes tense. Tense intimacy creates more friction and more risk of tiny tears for both of you. Simple action. Choose gentle, unscented soap on the outside only. Avoid internal products unless a clinician recommends them. A warm shower beforehand can be both bonding and practical. Keep it simple. The body is wise. What's worse is thinking more fragrance equals more clean. Often, it's the opposite. Gentle and basic is best. Less irritation means more ease and more enjoyment. Dry mouth and dehydration. Problem after 60. Many common medications reduce saliva. Blood pressure pills, some allergy meds, certain antidepressants. Dry mouth cracks tissue. Cracks invite trouble. Science, plain. Saliva protects. It's a natural moisturizer with enzymes. When saliva is low, tissues are more fragile. Personal impact. Dry mouth can lead to bad taste perception, soreness, and even dental issues. It can also make the experience less pleasant for you. Simple action. Hydrate. Sip water through the day. Use a simple water rinse before and after intimacy. Sugar-free gum or lozenges may support saliva. Avoid alcohol-based mouthwashes right before intimacy. They can sting and dry you out more. If dryness is severe, ask your dentist about saliva substitutes. Now, let's pivot from warnings to solutions and upgrades that most men find both respectful and effective. From here on out, we're stepping into what you can start today that builds safety, comfort, and closeness without even realizing how much stress it lifts off your shoulders. Gentle hygiene plus timing equals comfort. Here's the twist. Clean does not mean scrubbed raw. Problem, after 60. Overcleaning can irritate. Undercleaning can feel self-conscious. The sweet spot matters. Science, plain. Warm water and gentle, unscented soap on the outer areas lower odor without harming balance. Then time your oral intimacy for when your mouth is calm, not freshly abraded. Personal impact. When both partners feel fresh and unirritated, everything flows better. Confidence rises. That confidence protects mood, blood pressure, sleep, even how steady you feel during the day. Simple action. Plan a brief shower together. Keep it warm, not hot. No scrubbing sensitive areas. Rinse, towel dry, share a glass of water. Then go slow. If either of you notices irritation, pause and adjust. Comfort first, always. Let me clarify. The goal is comfort, not perfection. The body is allowed to be a body. Small variations in taste and scent are normal. Diet, hydration, and cycle phases can change things. If something seems suddenly different and uncomfortable, itching, burning, unusual discharge, that's a cue to check in with a clinician. It's not shame, it's maintenance. Use barriers when you want certainty, and keep options open. Problem, after 60. Sometimes you want intimacy but also want to remove worry completely. Maybe status is unknown. Maybe there's a healing sore. Maybe you just want extra protection. Science, plain. Barriers like dental dams or thin condoms cut down direct contact. Less contact with fluids and sores means lower risk of transmission. Personal impact. Removing worry restores enjoyment. When your mind is calm, your body responds better. Blood pressure steadies, muscles relax, you sleep better afterward. Simple action. Keep flavored or unflavored barriers in your nightstand. Choose latex, polyurethane, or polyisoprene based on allergies. Pair with a small amount of body-safe lubricant to avoid friction. This is not unromantic. It's wise. And wisdom is attractive, especially after 60. Stay with me for number 1, the change that surprises most seniors because it's simple, free, and often overlooked. It's the key that ties this whole topic together. Grand reveal. Your mouth. The calm mouth rule. This is the secret weapon. Unexpected but simple. Your mouth condition is the quiet gatekeeper of safety. Problem. After 60. Gums get thinner. Saliva can drop. Medications dry you out. Even careful brushing can open microcuts. Right after flossing or dental work, you can have tiny openings you can't see or feel. Science. Plain. Germs need a door. Microcuts and inflamed gums are doors. A calm, unabraded mouth is a closed door. That closes the pathway and lowers risk. Personal impact. Protect your mouth and you protect your energy, your independence, your routines. No surprise infections. No unnecessary antibiotics. Fewer down days. Simple action. Easy implementation. Time it right. If you plan oral intimacy in the evening, do it before your nighttime brushing and flossing. Then clean up gently afterward with a water rinse. If you just had a dental cleaning or any dental procedure, wait as advised, often at least 24 hours before oral intimacy. Keep tissues moist. Sip water beforehand. If you struggle with dry mouth, consider sugar-free gum or a clinician-recommended saliva substitute during the day. Be sore smart. If your gums bleed easily, see your dentist. If you have a cold sore, wait until it's fully healed. If you feel a cut or canker sore, pause and let it recover. Pair with the talk first ritual. A simple check-in. Are you comfortable? Anything tender today? Prevents guesswork and builds trust. Combine with gentle hygiene. Warm water. Unscented soap on the outside only. No harsh mouthwashes right before intimacy. Tie back to our opening promise. You wanted to know if it's safe. For healthy, infection-free couples, vaginal fluids themselves are usually not the problem. The hidden factor is the state of your mouth and the timing around it. That's the silent error many people make without even realizing. The good news? You can fix it today. Let's zoom out and put everything into a step-by-step plan you can follow this week. No overwhelm, just calm, confident action. Step 1. Adopt the calm mouth rule. Make oral intimacy happen before brushing and flossing, not after. If you've had dental work, wait until your dentist says you're healed. Skip oral intimacy if you have mouth sores, sore throat, or active cold sores. Step 2. Build the talk first ritual. One gentle question. Anything feeling sensitive today? One simple plan. Water, a quick shower, then we take it slow. Agree on testing if your relationship is new or non-monogamous. It's not unromantic. It's responsible love. Step 3. Keep it gentle and moist. Warm rinse before and after. Hydrate through the day. Consider sugar-free gum if dry mouth is common. For your partner, avoid harsh internal products. Gentle, unscented soap externally is enough. Step 4. Use options when needed. Dental dams or thin condoms are tools, not verdicts. They can be flavored and soft. A drop of body-safe lubricant reduces friction for both of you. If something looks or feels off, pause. You're not stopping intimacy, you're redirecting it. Step 5. Keep perspective. Taste and scent vary with hydration, diet, stress, and hormones. Variation is normal. A sudden unpleasant change with itching, burning, or unusual discharge? Reach out to a clinician. That's maintenance, not judgment. Remember, acceptance is more arousing than criticism. Kindness deepens trust. Trust deepens pleasure. Now, let's revisit the countdown with easy reminders you can screenshot or jot down on a card in your nightstand. Skip oral intimacy when there are active sores, cold sores, sore throat, or unusual irritation. Heal first. Don't do oral intimacy right after brushing, flossing, or dental work. Give your gums time. Calm mouth. Freshly scrubbed mouth. If relationship status is new or open, make testing part of your WE plan. It reduces worry and increases closeness. Avoid harsh soaps, perfumes, or douching that disturb natural balance. Gentle is best. Fight dry mouth. Hydrate. Rinse with water. Ask your dentist for saliva tips if needed. Gentle hygiene plus smart timing. Warm water. Unscented soap externally. Then go slow. Use barriers when needed. Options mean freedom. The calm mouth rule. Protect your gums. Time it right. That's your secret weapon. You may be wondering about taste and smell. Let's make this simple and kind. Taste can change with hydration, with diet, with stress, with the time of month. After menopause, natural lubrication often changes in volume and feel, and pH can shift. None of that is bad. It's the body being the body. You don't need to pretend you like everything all the time. You do need to be respectful. If something feels strong one day, you can suggest a quick shower together. You can sip water. You can add a barrier. You can come back to oral intimacy another time. What matters most is how you respond. Acceptance invites comfort. Comfort invites closeness. Closeness invites health. A few extra notes that help after 60. Medications. Many common prescriptions dry the mouth. If you wake with a dry tongue or sticky gums, assume you'll need water and gentleness. Keep a glass on the nightstand. Dentures and partials. If you wear removable dental work, take them out if they bother you during intimacy. Irritation under a denture can be a weak spot. Give it care. Seasonal allergies. A stuffy nose makes you mouth breathe, which dries your mouth. Rinse, hydrate, and slow down. Immune health. If you have conditions that affect healing, be extra cautious with sores and timing. Small steps make a big difference. Partner comfort. If your partner experiences dryness, they can talk to their clinician about options that may help with comfort. Lubricants can support both of you, and choosing products made for sensitive skin reduces irritation. Let's also clear away a few myths in senior-friendly language. Myth. If it tastes different, something must be wrong. Reality. Variation is normal. Sudden itching, burning, or unusual discharge is the signal to check in. Taste alone is not a diagnosis. Myth. Talking about testing kills the mood. Reality. Uncertainty kills the mood. Testing creates freedom. It says, I care enough to make sure we're both safe. Myth. If everything looks normal, there's no risk. Reality. Some infections have no symptoms for a long time. A calm mouth, wise timing, and, when needed, barriers are your practical toolkit. Myth. After 60, passion fades anyway. Reality. Passion changes. It can deepen. It often becomes kinder, more patient, more attuned. That's not less. That's richer. Let me give you 2 quick stories. Details change to protect privacy, that show what this looks like in real life. Story 1. A widower in his late 60s began dating again. He felt nervous about oral intimacy and safety. He and his partner did a simple thing. They agreed on a testing plan before getting intimate. They kept water on the nightstand. They chose before brushing as their routine. They also kept a flavored barrier in the drawer for days they wanted extra certainty. The result? Worry dropped. Sleep improved. Their confidence grew week by week. Story 2. A long-married couple in their 70s noticed more dryness and occasional irritation. They didn't want to lose their spark. They moved intimacy earlier in the evening, added a gentle shower together, and used a little body-safe lubricant. They also paused oral intimacy anytime either one had a mouth sore or felt under the weather. They stayed playful, not perfectionistic. They both reported feeling closer than they had in years. Now, about your partner's feelings. Many women carry shame around this topic because culture has been unkind. You can help change that. A simple phrase can make a huge difference. Your body is natural. I'm here to make this comfortable for both of us. That one sentence says, I'm safe, you're safe. We're a team. When you respond with acceptance, arousal often follows. When you respond with criticism, intimacy shuts down. After 60, kindness is not just good manners, it's good medicine. Let's circle back to safety in clear language you can trust. For healthy, infection-free couples, swallowing vaginal fluids is generally considered safe. Oral sex can, in some cases, transmit infections if one partner is infected, even without symptoms. The biggest overlooked factor is the state of your mouth. A calm, unabraded mouth lowers risk. Timing, hydration, gentle hygiene, and honest talk are your everyday tools. Barriers are an option, not a judgment. If you notice new or worrisome symptoms, mouth sores, genital sores, itching, burning, unusual discharge, pause and get checked. Why does this matter so much after 60? Because every avoidable infection is a week you could be walking more, sleeping better, and enjoying life instead of sitting in a waiting room. Because steady energy protects balance. Better sleep protects mood. Good mood protects relationships, and strong relationships protect health. It's all connected. It's not too late. Let that sink in. It's not too late to learn new habits. It's not too late to protect your health. It's not too late to enjoy intimacy safely and confidently. You've done hard things in your life. You can absolutely do this. Here's your 5-step action plan for this week. Adopt the calm mouth rule. Schedule oral intimacy before you brush and floss. Rinse with water after. If you had dental work, wait as advised. If you have a sore, heal first. Do the 10-second talk. Say, anything sore or sensitive today? If yes, adjust. If no, relax and enjoy. Prepare the nightstand. Water bottle. Gentle lubricant. Optional barrier. That's your calm kit. Keep it gentle. Warm shower together. Unscented soap on the outside only. No harsh mouthwash right before. Agree on health checks. If your relationship is new or open, plan testing together. If long-term and monogamous, check in if anything changes. Keep the conversation easy and routine. If this resonates, type 1 in the comments. If you're not sure yet, type 0. That small interaction helps other seniors find this information, and it helps you commit to your plan. And if you'd like me to cover how to keep strong pelvic health and better bladder control while staying intimate, tell me next. Pelvic tips in the comments, and I'll make that the follow-up. Because better control means better confidence. A quick, natural disclaimer woven into our close. I'm sharing education, not personal medical advice. Your situation is unique. If you have specific symptoms, conditions, or concerns, please talk to your clinician or dentist. They can tailor this guidance to you. That's the safest path. Before we finish, let's anchor the big ideas one last time with gentle repetition, the way our brains learn best after 60. Silent error number 1. Tiny mouth cuts from brushing, flossing, or dental work. Time intimacy before brushing and wait after procedures. Silent error number 2. Assuming looks normal means no risk. Some infections are silent. When in doubt, talk and test. Silent error number 3. Harsh products. Keep hygiene gentle to protect delicate tissue. Silent error number 4. Dry mouth. Hydrate, rinse, and ask your dentist for help if it's persistent. Secret weapon. The calm mouth rule plus kind conversation. Simple, free, powerful. You've got this. You can protect your health, your independence, and your connection. You can enjoy intimacy without fear and without shame. Age does not cancel desire. Wisdom refines it. And when wisdom leads, closeness follows. If today helped you breathe easier, say 1 in the comments. If not, say 0 and tell me what's still unclear. I'll help you make it practical. And if you want the next step-by-step on pelvic tips after 60 to support stamina, control, and comfort, write next, pelvic tips. We'll keep learning together, one calm, confident step at a time.